Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
New plans from the Health Secretary, plans to treat an extra 1 million mental health patients over the next 4 years. They have been proposed by the government. You'll have heard about it before the election. However, the Royal College of Nursing says that they'll need to be hard cash to deliver these services. Well, let's speak to the Health Secretary, Jeremy Hunt, now. He's at the forefront of all these plans. He joins us now from our Westminster studio. Good morning to you.
Morning, Sarah Jane.
Now, you are calling this ambitious, these plans that you set out before the election. However, doctors and nurses are calling this unrealistic. How do you plan to recruit an extra 21,000 mental health staff within the next 4 years?
Well, I think it's been very warmly welcomed by doctors and nurses. The Royal College of Psychiatrists has given it a very warm welcome. And in fact, these plans have been drawn up both by the NHS and by charities who are very involved in the delivery of mental health care, precisely to make sure that we don't just give a number and say we'd like to treat 1 million more people by 2021, which is a nice sounding number, but actually back it up with the hard increases in mental health nurses, psychiatrists, therapists, all the people you need to deliver a big change like that. Okay. And it's going to be a very big effort, but we have increased the number of people in mental health provision by 32,000 since 2010. This is another 21,000 posts. And I think if we go hard at it, we can deliver it, and it's very important we should, because although we have one of the biggest expansions of mental health provision in Europe, we still have too many tragedies, too many young lives cut short because we're not helping people quickly enough. It's widely
agreed there is definitely need for improvement, and yes, it has been welcomed by doctors and nurses and other healthcare professionals. But with a degree of scepticism. You talk there about hard increases in numbers. They're talking about hard cash. They need hard cash to make it work. How are you going to fund this?
Well, this is part of a £1 billion annual increase that we're committing to. So we are paying for this with new additional extra money.
And where is that coming from?
Well, it's from the settlement that we gave the NHS at the last spending review, which we promised an extra £8 billion a year. Part of that is an extra £1 billion to mental health. And I should say that compared to just 3 years ago, we're spending about £1.5 billion more on mental health in real terms. That means about 120,000 more people every year getting treatment. But as I say, we're not...
Sorry, I do just want to interrupt you because I know that you have limited time, you have other places to go today, so I just want to get into this a little bit more. You have promised this money. Again, I'll ask you to be specific about where it's come from. It's one thing promising it, but when you look at recruitment across the NHS at the moment, you are struggling to recruit in other areas. I mean, it comes at a time when NHS digital figures show that over 86,000 posts advertised within the NHS in the first quarter of this year, a large number you simply can't fill. So you do wonder how you're going to recruit an extra 21,000 nurses and other professionals to work within mental health. What's the incentive? How are you going to get them into the NHS? Because you've got a 1% pay cap still in force, and you also have the uncertainty of Brexit. EU health professionals don't really want to come to the UK at the moment. It's not very attractive to them.
Well, the reason that we are able to make this commitment is, first of all, it's against a background. Yes, the vacancies are going up, but so are the numbers of people working in the NHS. We've got nearly 12,000 more doctors in the NHS than we had 7 years ago. So the overall numbers are going up, but so is the demand because of an ageing population. And I would question that the NHS is an unattractive place to work. Just 2 weeks ago, an independent American think tank, the Commonwealth Fund, said that the NHS was the best healthcare system in the world, better than France, better than Germany, better than Australia, America, many other countries. But we have our pressures, just like everywhere has their pressures. And part of this is about training more young people to go into medicine, and that's why we've increased the number of training places at medical schools by a quarter. Very big decision that Theresa May took just after she became Prime Minister. But part of it is also encouraging people who have been trained in the past to come back into working for the NHS.
Because we know that there are
a number of psychiatrists,
I understand you want to encourage people back and you want to recruit new staff. But, you know, if you were talking to somebody about a career in mental health at the moment, how would you sell the job to them?
Well, what I would say is look at what the New York Times said just last week. They said that here in Britain we have the world's most ambitious effort to tackle depression and anxiety, more than is happening anywhere else in the world. People are looking at what we're doing here in mental health. And we recognise there's a lot more to do.
But that's because in America you have to pay for
treatment.
treatment, and a lot of people can't afford mental health care.
Well, we also, in that Commonwealth Fund survey, are rated as the most equitable healthcare system and the system in which it's easiest for people from low-income backgrounds to access good healthcare. So we have a lot that we can be proud of. We have lots of pressures, but we want our mental health provision to be the safest and best in the world. This is a big area of expansion, and we're putting our money where our mouth is, which is why we're creating over 20,000 extra posts in mental health over the next few years, so that we really can treat more people and give people the kind of care that we'd all want.
Talk to me about those 21,000 new jobs. A lot of talk about mental health nurses, but they're limited. They can only medicate. What happens after that? There's a lot of talk about the fact that the NHS, the mental health service, are not joined up. What happens once somebody has seen a mental health nurse? How much provision is there going to be for care when they leave hospital or the medical environment? What kind of positions are given priority, and who's been advising you on where the priority should be?
Well, the advice has come from doctors inside the NHS and charities who we work very closely with, like Mind, who are very close to the front line of what's needed. And what they say is that mental health conditions are very varied. And for some mental health conditions, you want a talking therapist who can give you a course of psychological therapies to help deal with depression or anxiety, and that's enough. Other people need to be referred to a psychiatrist, which is why we have more psychiatrists and we want to recruit yet more. Other people, absolutely right, do need health in the community, which is why we have more community psychiatric nurses than we've ever had before. So you put all those things together and you need a mixture. But what today's announcement will mean is, for example, an extra 2,000 people working in children and young people's mental health provision, an extra 4,600 nurses working in crisis care, because that can often be, if you like, the A&E of mental health provision. If someone has a mental health crisis, they need help urgently. We're going to have an extra nearly 3,000 people working in tackling depression and anxiety. So we've taken independent advice, we've put it all together, and we've got this big commitment that says we want to be treating 1 million more people every year by 2021. And we've said, well, if we're going to do that, yes, we've got to put the money in, but also we've got to have the people there who can actually deliver that care. And I think that's what, in the past, governments on all sides have not done right. They've recognised the money bit has to happen, but they haven't got the proper strategic workforce planning right. And that's what we're trying to do today.
OK, Jeremy Hunt, Health Secretary, reiterating those plans made by the government for 21,000 extra mental health staff within the next 4 years. Thank you for speaking to us here on Sky News Sunrise this morning. We are now going to take a look through today's papers. The former RAF navigator turned motivational speaker John Nichol and Lucy Fisher, senior political correspondent at The Times, are here with us. Good morning, both. And Lucy, you heard what the Health Secretary had to say today, and that's your top pick from the papers today. It's the front page of the I newspaper today, these new government plans. Were you convinced by what the Health Secretary had to say there? Are his plans ambitious or unrealistic?
Well, I think it's difficult. You gave him quite a grilling.
Grilling? Quite a grilling.
So, Jane.
Well, we need to know how these plans are going to work, don't we?
Absolutely.
It sounds brilliant and everyone welcomes them, but are they realistic?
I'm not sure. I think trying to tempt people back into the NHS who've already left doesn't sound the most plausible plan. And certainly the Royal College of Nursing has come out today and said, well, while they welcome the extra funding and the ambitions, this has to be set against the backdrop of years of cuts now, decisions by the government to change, for example, the bursary scheme that helped nurses and midwives study.
Decisions by this government as well. Since 2010, the number of mental health nurses under this government in England has dropped by 6,000.
Absolutely.
And now they want to get them all back.
Absolutely. I mean, if they're already struggling to recruit people, then, I mean, how they're going to build 20,000 new roles by 2021, it seems unclear how they will achieve that. But I think everyone can agree that certainly there needs to be more done. I'm looking at the figures in the eye today that antidepressants have been risen a staggering 100% in the past 10 years to 64 million prescribed last year. Clearly, all the political talk about the need for parity of esteem between mental and physical health is something that needs to be sought after in the UK.
As somebody, I mean, so I've been involved in military mental health for many years now, and suffered post-traumatic stress disorder myself, and I'm really interested in this, especially this notion about the antidepressants. I'm no expert clinician by any sense of the word at all, but a lot of this, and you actually pointed this out really carefully, Sarah Jane. Yes, you can have nurses as that first point of contact, and they can prescribe and they can help, but in many cases, a lot of people need proper therapy, and that is experts.
They need day
centres,
they need people to see them at home, they need long-term care plans.
And so that first, point of contact with a nurse or something is very important, but many people with mental health problems, again, from the military perspective as well, need long-term help, and that will help them, that will cure them, that will really solve the problem, but that's about people.
And what about the mental health problems that can't be, you can't use medication for that. Not every mental health problem needs a
lot of it is about learning why you have those problems. Look, I mean, it's important that they're doing it, there's no doubt about it, but I think there's going to be a lot more that needs to be done.
Well, joining us now from Westminster is the Shadow Minister for Mental Health, Barbara Keeley. Good morning to you.
Good morning.
You were just listening to that response there from the Health Secretary, Jeremy Hunt, about his plans, which he says are ambitious. However, critics are saying they are unrealistic. What do you make of them?
Well, I think we need to see where is the money coming from. Is there enough money? That's the first thing. And, is it going to be enough? The £1.3 billion which he's talked about is actually money which is committed for other things, and he's only part funding this recruitment drive. And as you say, it's become very difficult recruiting nurses because of the 1% pay cap, and because, of course, they've scrapped the nurse bursary. This government has scrapped the nurse bursary, making it harder for nurses to train.
What do you think would be an incentive for people to train as mental health care professionals? As I said, the government is looking for 21,000 of them over the next 4 years.
Well, I think what we need to see is a greater deal of ring-fencing funding. During the general election campaign, Labour talked about ring-fencing funding. There's a great deal of robbing Peter to pay Paul that goes on in the NHS, with funding that's meant, say, for children and adolescent mental health services, going for other things, because at local level, the other priorities drive things. So if there's a need for other funding, it doesn't get used for mental health, and that's really a big difference. And of course, that means that the staff working in mental health services are stretched. The workload goes up and up and up. We know that waiting times for all kinds of treatment are a problem, are really stretching now. So workload is difficult, the pay is capped, and it just, that's a crisis situation, really. It's not a good background for recruitment.
The one thing that the Health Secretary, Jeremy Hunt, did say is that action on mental health care is welcomed across the NHS. And you cannot deny that. Action does need to be taken. It's been left to disintegrate for far too long. How would you fund any improvements?
Well, we committed to fund the NHS better. I mean, I talked about the robbing Peter to pay Paul thing. If the NHS had better funding, that wouldn't be going on quite so much. There's a great deal.
How much would you ring fence for mental health?
We would be committing an extra £1 billion. That's over and above the funding that's already there, because we really. And I think the second thing, one of the most important things, is to scrap the pay cap and to bring back nurse bursaries. Each of those things that we committed to during the general election campaign, and I think that would make the situation much easier. To scrap the pay cap and to bring back bursaries, would that be included in the extra £1 billion? Would that be enough? No, it wouldn't. No, £1 billion is actually needed for services, but we also committed to scrap the pay cap and to put that back to independent review.
OK, so I'm just doing some rough maths. If the Conservative government are promising £1 billion, which they say they already had, this isn't new money, they'd accounted for that. You're promising an extra £1 billion. You're also promising extra money for bursaries and to increase the pay cap. you know, people are throwing figures around willy-nilly. Where is this money coming from?
Well, I think that's the question for Jeremy Hunt to answer.
Yeah, but if you're going to criticise his figures, we do have to examine yours.
We had a fully costed document out in the general election that linked to all of our commitments. The Conservatives did not. So I really think you should put the question back to him.
OK, well, just remind us of how you costed that manifesto then, in terms of mental health.
In terms of mental health, that was part of the 30 billion commitment over a parliament to the NHS to increase funding for the NHS. And that came from a number of different sources. Predominantly came from increases in income tax at the higher level, but there were a couple of other elements. But there really was a fully costed document that went with Labour's proposals. There was no costed document that went with funding for the government, and we don't know where this money is coming from. So I think you should put the questions back to Jeremy Hunt.
Well, I did put those questions to him, but you have to admit, in fairness, I have to put that question to you.
Yes,
so you're
you
saying
do.
that you're saying
you
that
do, but he's actually saying that he's going to recruit 21,000 staff. A thought here, 21,000 staff only paid at the level of a newly qualified nurse would be £483 million. So this £1 billion would only last 2 years. It's meant to stretch 5 years. So I think there are some serious questions.
There are some serious questions in terms of, yes, 21,000 extra staff. But what would those staff be doing? We talk a lot about mental health nurses, but that's only, you know, the tip of the iceberg. They can prescribe medication, but it's what happens to those patients after that. A lot of people who have mental health problems, they can't be helped with medication. They need therapists, psychologists, home care, 24/7 drop-in centres. So would the money and the plans Labour have, for example, be able to cost all of that? Because that is the real worry. So many people are owning up to having mental health problems and wanting to talk about them, but they have nowhere to go.
Yes, indeed, and that's a tragedy. And I think there are other things too. I mean, children are being treated on adult mental health wards because there aren't enough beds. This links to whether there are enough nurses and other staff on wards. Many patients are being treated in other parts of the country. You might have an eating disorder and have to travel 200 miles for treatment. All of this needs to change. But, you know, there's got to be a solid and short-term and medium-term commitment. And I think making very substantial claims about recruiting thousands of staff, including, if you like, psychiatrists. It takes 13 years to train a psychiatrist. So I think we really need to question this and say, yes, it's admirable to have an ambition to do this, but where's the funding coming from? Will it stretch? And how are you going to overcome the morale and pay problems which are causing recruitment issues now?
OK, Barbara Keeley, Shadow Minister for Mental Health, thank you for speaking to us here on Sky News Sunrise this morning.
So let's take a look at the figures for this plan. 21,000 new posts created.
And that includes 4,800 specially trained nurses and therapists working in crisis centres.
And 2,000 new staff dedicated to child and adolescent mental health.
There'll also be an additional 2,900 therapists for adult talking treatments such as cognitive behavioural therapy to treat depression. Well, Norman Lamb is the Liberal Democrats spokesperson for health and a former health minister. He joins us now. At £1.3 billion to be invested in mental health. This must be something you're welcoming.
Well, on the face of it, I absolutely welcome this plan. The question is whether it's deliverable. The 1.3 billion you've referred to is not new money announced today. It was announced some time ago, and it's part of the government's overall plan for the amount of money they're prepared to invest in the NHS, and everyone outside government believes that that's not enough. And it's interesting, just in your own news headlines just now, there was a report that there are concerns that the plan for 5,000 more GPs is falling short, and that numbers are actually falling rather than increasing. So, you know, I'm afraid I've become a bit cynical about these numbers announcements that sound great when they're announced, but when the reality strikes, you actually have to make the money available to employ people and to train them, and that's what's missing.
But why do you think it won't be deliverable? You know, if people do start to embark upon their training now, there'll already be people who are in the system who will be finishing their training and be ready to work in a couple of years' time. Why do you think it won't be deliverable?
Well, there are already thousands and thousands of vacancies in mental health services for nurses, for example, across the country. But the central point I make is that the government's plans for investment in the NHS between now and 2020 simply do not provide the resources necessary to make this actually happen. Everyone outside the government says that the money is not enough. And when you see, the point I was making is, you see that they made a big announcement about 5,000 more GPs by 2020, and you look at the reality with numbers actually falling over the last year. And I think this is what makes people so cynical about politics. You know, big, grand plans and announcements not followed through with the reality that you need to actually deliver this.
The government says that there are 32,000 more people delivering healthcare than there were in 2010. They would argue that they have put a lot of money into it, and obviously that's something that you dispute. The other thing that they're talking about today, as well as more workers in the mental health sphere, is better integration, a better way of structuring the system. Now, that's something that won't necessarily cost a lot of money, but do you think that that could bring benefits?
First of all, there has been marginally increased funding in net terms, in real terms, since 2010. But it's the toughest period that the NHS has ever been through. And the critical thing is you have to compare that with the level of increased demand, which is rising at about 4% every year. It's just not keeping pace. That's the problem. In terms of how we spend the money, it's absolutely right to join up physical and mental health much more effectively. Too often people fall through the gaps between different services, which causes enormous frustration and distress for many families. But, you know, the reality in the service at the moment, I had a dad in my advice surgery recently who had a 17-year-old daughter who'd just been told that she was having to wait 6 to 9 months to start treatment for serious mental ill health. Now, we can't tolerate that situation. We are letting people down very badly. So the plan to increase this investment or increase the numbers is right. The ambition to join up services much more effectively, to focus more on prevention, is absolutely right. But the government needs to put its money where its mouth is and to make the additional investment that will be necessary to deliver this plan.
What about bursaries? Bursaries for those wanting to embark on a career in nursing were available. They've been withdrawn by the government. Do you think that they need to reintroduce these to encourage people back into the health service?
Yes, I do, because what we've seen since the announcement is a dramatic drop-off in the number of people applying to go on to nursing training courses, and particularly mature students. So if you've been involved in some other career, you perhaps are in your 20s or your 30s, and you want to go into nursing, who is prepared in those circumstances to take on a very substantial additional debt? And my real fear is that we will fall short of numbers for nursing overall, quite apart from the absolute necessity to bring more young men and women into mental health nursing.
OK, Norman Lamb, thanks very much for joining us.
Thank you very much.
Now, it's several years since the government pledged to put mental health provision on an equal footing with other health services. But many patients still struggle to access the services they need. It's a problem we've covered extensively on this programme. So will plans to recruit more than 20,000 extra mental health workers in England improve things? The plans involve increasing the number of trained nurses, therapists and psychiatrists and other mental health professionals by 2021. Well, earlier, the Health Secretary Jeremy Hunt explained the numbers to Naga Munchetty on BBC Breakfast and said nurses have never worked harder.
The 21,000 number is for posts overall. That isn't just nurses, that is psychiatrists, that is therapists who help people with conditions like depression and anxiety, and nurses and people working in different parts of mental health provision. But nurses are a very, very important part of it. And we are confident that we can get these numbers. There are people who are trained in mental health nursing, people who are trained as psychiatrists who are not currently working in the NHS, and we have a programme to attract them back into the NHS. And what we want to say to them is that we probably have the biggest expansion in mental health provision in Europe going on at the moment. We're proud of what we're doing. But we want to do a lot more. We still have too many people in this country who, where a young life is blighted because we're not getting them the mental health care that they need quickly enough. We have too many older people who are living in isolation and suffering from depression, and they think it's automatic, and we want to sort those problems out.
This is a very important issue. I don't think anyone would deny that. And when it is such an important issue, I wonder how you think you're going to recruit nurses when there's a 1% pay cap, when it seems that all you're going to be doing is, pasting advertisements for a job which many think is underpaid, low paid, and your pay rise is going to be less than inflation, so you're actually earning less money each year doing a job that is, frankly, really hard.
It is a very tough job, and I would say that nurses on the front line have never worked harder. But we are expanding the nursing workforce. We have nearly 6,000 more nurses on the front line than we had in 2010. We want to expand it further. One of the reasons that we have been able to expand the workforce to date is because with a limited budget, a very difficult economic situation, we have shown pay discipline, but we have to balance that against the need for recruitment, the need to keep people in nursing, and that's why we have this independent process with the pay review body, and that's why, as I say, we will listen carefully to what the pay review body says before we make our final decision.
Well, earlier we spoke to Mandy Stevens, who's worked in mental health services for 30 years and recently found herself admitted to a mental health unit. Paul Farmer from the mental health charity Mind and Stephanie Aitken from the Royal College of Nursing.
So we'd welcome it because anything that actually addresses some of the issues that we've got around parity of esteem across physical and mental health is really important. But we do have concerns about the fact that in terms of recruit, retain and retrain, that how is that actually going to happen? So we think they're laudable ambitions, but there's very little detail in the plan about how that's actually going to be achieved.
So to deliver the number of staff that Jeremy Hunt is talking about, when would these people need to start their training? How quickly would you need to get people?
So if you're looking at recruiting into posts for 2020, they need to be recruited from this September. And with the changes in student funding at pre-registration level, then there are real challenges around that. We know currently that it is less attractive and that the numbers are down for recruitment for September.
I think the challenge is that at the moment we have a huge amount of inconsistency in terms of what people experience locally on the ground, and often that is because of the very huge variety of staff availability and staff capability as well. And we've never had a plan for mental health staff before, so this is the first time that we're actually seeing those kinds of elements coming into play. But it's a big challenge to get there over the next 4 to 5 years.
Do you think needs to change in order to attract those members of staff that would be amazing, as Mandy had experiences, and retain them?
So there's a lot of stigma still around mental health. So there's something about, I would support any campaign that actually really makes clear what the valued contribution people who work with those with mental health in a range of different roles, but particularly for us in nursing, actually add in terms of that. There's huge job satisfaction, but job satisfaction isn't enough. People also need recognition, and they need to be able to actually feel that they're able to support themselves and their families and loved ones in the role that they are. And actually, we've seen that the pay has actually, the value of your pay has gone down for nurses over years, and that's why we've launched our Scrap the Cap campaign. People need to actually have recognition, both financially and in terms of the value that society offers.
So I wonder, do you think that this is going to put mental health services on a par with physical services, for example, Mandy?
Well, we really welcome the plan, and I think it's certainly going to go a long way to support and engage a forward movement, but I think there's still a long way to go. It's great in the document they're talking about, I think it's 5,000 staff coming into crisis services, so when people are desperate and really need urgent care, there's somebody immediately available.
Which doesn't happen now, does it?
It does, but it's patchy across the country, I think it's fair to say. So again, my experience was great, but
we've heard stories of people where it's not so great.
And where you have long waiting lists and things. But the most important thing with all healthcare is to support people to stay well and safe at home in the community. So putting all of the resources into preventative mental health care and community services to keep people safe and well, which will then prevent people getting more unwell and needing to come in to hospital, for example. So I'm hopeful that through counselling, therapy, support services, community psychiatric nurses, in liaison with the voluntary sector, we can invest in keeping people, supporting people to stay well at home, because then it's better for the people, better for the families, better for our communities, and it's also a lot cheaper than coming into hospital and using very expensive resources, and it's just very traumatic.
Well, let's speak to the Shadow Minister for Mental Health and Social Care, Barbara Keeley, who joins us from Westminster. So would you recognise what we heard there from many people, that this is a good start?
Well, of course, it's good to have an ambition to increase dramatically the number of staff working in mental health services, and particularly in crisis services, because the very recent report of the Care Quality Commission pointed out that staffing was the key issue causing a problem with patient safety. And we know that it's very difficult to get access to things like eating disorder services. It's very difficult for people with children and mental health needing access to treatment, for them to get access to the treatment that they need. So of course it's welcome, but let's be realistic. I think that's what we're saying this morning. Let's be realistic. It takes time to train a nurse, and there's a big workforce recruitment crisis at the moment because of the pay and morale and conditions issue that you've just heard about.
But as we heard from the gentleman there, Paul Farmer, from the charity Mind, there has never been a plan before. And he said, there's never been a plan. So you have to start somewhere, and at least now it's being recognised, and there's an attempt to put mental health services on a par with physical health services.
Yes, I mean, I always feel that, you know, we're a long way from that. So that's always a strange way to talk about it. I mean, clearly you're not in a situation, when I talked about children and young people, 23% of children and young people referred by their GP for treatment get turned away. That doesn't happen with physical health. And it's part of the problem that we've got in the lack of parity between the two. But that's not the most important thing. The most important thing is that we get the staffing levels up, that we get the service levels up, that we improve access. And for that, really, the funding has to be sorted out. And quite rightly, people have been questioning this morning whether this £1 billion part funding can actually go anywhere near meeting these targets of thousands of staff. You know, I don't argue with the numbers in any way, shape or form, apart from the fact that the 4,600 extra mental health nurses wouldn't even take us back to where we were in 2010. You know, but it takes 13 years to train a psychiatrist, so let's be realistic about where we can be by 2020-21.
But we have also heard that there are many people who are trained, who have decided to leave the profession, or indeed haven't been able to get paid jobs. We had one lady on who said she trained many counsellors and they simply couldn't get paid jobs. So if all of those people can be pulled together, you can pull back people who've left the profession, you can bring in the people who've been trained, they'd be ready to go now.
Yes, they would, and I think that, you know, the other thing I would like to see Jeremy Hunt announcing is when he talks about funding, any extra funding for mental health, that he talks about ring fencing it, because we've seen attempts by the government to put extra funding, for instance, into child and adolescent mental health services, and then NHS bodies just siphon the money off and use it for other things. So we've had, you know, this loss of mental health nurses, so we've got crisis problems that we have and problems on wards. We've also got problems with community resources, the very community resources which can be so valuable. So we're not into early intervention and prevention because those resources are being cut back, and the voluntary sector has been cut back, you know, worse than any other part of this sector at the moment. So those things need to be addressed. I would really like to see the government ring-fence funding for mental health.
Thank you very much for speaking to us, Barbara Keeley there from the Labour Party. She is the Minister for Mental Health.
The government want to recruit an extra 21,000 mental health workers in England over the next 4 years. The Health Secretary, Jeremy Hunt, says it's time to end what he called the historic imbalance between mental and physical health services. But the Royal College of Nursing has questioned whether enough new staff can be trained in time. Here's our health editor, Hugh Pym.
As a teenager, Hope had a serious eating disorder. She thought she'd got through it after treatment. But last year, a family bereavement triggered a relapse. She was offered therapy, but was told there would be a 12-week wait. News, she said, was devastating.
The way I was treated last year wasn't right. Like, there were points when I did want to kind of end everything, and when I never thought I'd ever be well again. And it was at those points that I was so angry and annoyed at the system. Because when you cry out for help, you already feel guilty because you've got this voice in your head telling you that like you shouldn't be eating, you shouldn't be asking for help. So when you do call out for help and then you get turned away, you then think that actually no one does care about you, no one kind of understands what you're going through.
To cut down waiting times and expand mental health services, the government has announced an expansion of the workforce.
We've worked out exactly how many more doctors, nurses, therapists that we need. We worked out where we think we can get them from. Like all plans, it will be challenging to deliver it, but we are determined to hold true to our promise to transform mental health services.
The plan for mental health staffing involves an extra 21,000 posts in England by the 2020 financial year. This will include children's services, adult talking therapies and crisis care. But official figures show there was a fall of more than 5,000 in the number of mental health nurses in England between March 2010 and March this year. The move's been welcomed by the Royal College of Nursing, though its leaders are sceptical about what can be delivered.
How are we going to do that in such a short timescale when other policies, other government policies are actually getting in the way of that? So we already know we've got 1 in 10 posts in mental health vacant, so we've got to fill those as well as putting additional nurses in.
Critics argue that capping public sector pay rises and abolishing free tuition costs for trainee nurses in England will make it harder to recruit and retain staff. Hope says she's pulled through her latest mental health setback, but she believes a lot more needs to be done to ensure people get the care they need when they need it. Hugh Pym, BBC News.
Now, the government's announced a massive expansion plan for mental health services in England. The Health Secretary, Jeremy Hunt, wants to create 21,000 new posts, aiming to treat 1 million extra people. He claims it will be one of the biggest expansions of mental health services in Europe. His critics, though, say it is too little, too late. Richard Pallow reports.
For 2 years, Pippa McManus struggled with anorexia, and when she needed help most, mental health services failed her. The 15-year-old taking her own life just days after being released from a psychiatric hospital. No adequate care plan was in place. Her parents hope today's proposals can prevent similar mistakes.
So we can hope now change for the better. We don't, what we said in the early days is we don't want Pip to be a statistic, which is what she is now, sadly.
Ward rounds this morning at St Charles's Hospital in London.
Hi, good morning. Good morning. How are you today?
As all over the country, staff here face mounting workloads. Treating patients on the same site where Florence Nightingale once founded a school for nurses.
Budgets are very tight.
The recruitment and retention of mental health practitioners remains problematic.
I think, we have an issue with vacancy rates that we are actually addressing at the moment already, and that the government has put forward this plan, and I welcome that. But yeah, I think there's still a bit of work to be done in terms of recruiting more staff.
There are just under 39,000 mental health nurses in England. Numbers have been falling, though. In last July, there were 6,600 fewer than in 2010. The plan is to create 21,000 new posts, including nurses, consultants and therapists, to treat an extra 1 million patients.
We've worked out exactly how many more doctors, nurses, therapists that we need. We worked out where we think we can get them from. Like all plans, it will be challenging to deliver it.
But nursing bosses think the cancellation of bursaries and the NHS pay cap is putting off applicants.
Take away that need for a loan, particularly for mental health nurses who could start very, very quickly. Also look at the policies of the pay cap, which is making people leave the profession, creating so many vacancies. So review the mistakes, admit to those mistakes.
It takes 3 years minimum to train a mental health nurse. And with the funding for this sector not ring-fenced, many wonder whether the government's laudable ambitions may remain only that. Richard Pallow, ITV News.
The Health Secretary, Jeremy Hunt, has announced plans to recruit thousands more mental health workers in the hope of having enough staff to treat 1 million more patients by 2020. Critics have questioned how it will be funded and point out that thousands of current posts are still unfilled. We'll hear from Mr. Hunt in a moment, but there is little doubt that the current system needs to change. This programme has learned of a 14-year-old who spent 10 days on an adult intensive care psychiatric ward because there were no beds available for adolescents anywhere in England. His mother has spoken to our health and social care correspondent, Victoria MacDonald, about the battle to help her son.
A teenage boy's bedroom, a room once filled with music. But he is not here. Instead, the 14-year-old who should be playing the piano, on his drums, kicking that ball, is sectioned in a mental health hospital.
Towards the end of year 7, going into year 8, so sort of 12, 13, and it was around the sort of autumn term in year 8 where things really started to go downhill, and he was really quite sad, and he was drawing back from activities that he really enjoyed doing before, not wanting to do them. And that's when he started self-harming, although it wasn't obvious at first.
This mother didn't want to be identified, but she was desperate to speak about the months where she begged the children and adolescent mental health services, or CAMS, for help as he made attempts on his life, as he became more and more depressed.
My child asked me if CAMS were now going to help him. And I said, yes, they're going to help you, but you need to stay at home for them to help you. At which point he became really, really angry. And he started hitting himself really hard around the face. And he was in a real rage. And he turned and he saw a full-length mirror on the wall, and he picked it up and threw it against the wall. So I picked up the phone to the police straight away because I didn't know how things were going to pan out. And at which point this mirror had shattered all over the floor, and my son had picked up a shard of glass and started slashing at his arms and legs.
Finally admitted to an adolescent mental health hospital, he was diagnosed with autistic spectrum disorder and depression. His mother has no criticism of that care, but it's what happened next. A psychotic episode caused in parts by being on the unit for too long. Against all the guidelines, he was put in seclusion on an adult psychiatric intensive care ward. There were no children's beds available in the entire country.
It's a part of the ward that should only be used really for assessment, so it should only really be used for 2 or 3 days maximum, and our son was in there for 10 days.
For some of the time, he slept on a mattress on the floor with ill-fitting and at times filthy bedding.
We had a phone call from our son telling us that a patient had been in his room, and he was absolutely terrified and he was crying. And I thought, this can't have happened. So I asked him to hand the phone over to one of the members of staff who was with him. And he said, yes, that had indeed happened. And what had happened was a member of the staff had come in to have a look, to check on my son. And when they'd gone out, they had failed to lock the door.
There are only 149 children's psychiatric intensive care beds across England, the demand far outstretching the supply.
I mean, I remember when I was a junior doctor going on such a unit for the first time, finding it somewhat intimidating, so it would be particularly difficult for an unwell teenager. Teenagers need to be placed on wards which are age appropriate, which are developmentally appropriate, with staff who are trained in working with children and young people. And being placed on an adult psychiatric intensive care bed, adult intensive care unit when you're a teenager is not appropriate.
But why did this 14-year-old end up in this situation? Why has he been in a mental health hospital for a year when it should have been months at the most? Why, when even a tribunal has ruled, he can be moved to a residential unit? His lawyer says it is a funding row between health, education and social services.
The problem is, it seems to me, that the departments within local authorities don't even talk to each other. So they're supposed to produce what's called an education healthcare plan, which education healthcare seems simple, doesn't it? But it just doesn't work out like that. So these things are written by education departments, and then they argue about who should fund. And that means that my client spends longer and longer in hospital until this is sorted out.
He doesn't really need to be in hospital. He needs to be in a therapeutic environment where there's education, where he has access to the outside, where he has access to exercise. Because hospital is not a long-term solution.
An NHS England spokesman said they were making progress with mental health, but added,
increasingly complex needs means we need to work even better across children's services when responding to young people with a range of complex issues. All relevant organisations have a duty to cooperate and agree a joint package of care where appropriate.
There is more money going into the system, though sometimes it's hard to see where it's ending up. And there is definitely political will to improve mental health services. But the years of neglect are going to take a long time to remedy. And in the meantime, children, like our 14-year-old boy, are not receiving the help that they desperately need. And both his mother and his lawyer say the same thing.
What's really annoying is that this is a severe mental illness that causes a huge risk to his life. If it was a physical illness, there would be a bed in an intensive care unit. But this is mental health. The stigma is such that funders get away without providing sufficient beds.
How have you coped?
There are very dark days where it's really very difficult, and it's very difficult to see your child suffering, and it's very frustrating to argue with authorities and feel that it's, you know, they don't have the money or they don't take the responsibility for your child, and that's really hard. But I think that's what drives me is wanting the right thing for him.
Well, a short time ago, I spoke to the Health Secretary, Jeremy Hunt, and I asked him first for his reaction to Victoria's report concerning that teenager forced to spend days on an adult psychiatric ward.
I don't think that anyone would say that the state of mental health provision for children and young people that we have today in the NHS is acceptable. I am incredibly proud of what we do in the NHS. And in fact, our mental health provision, according to some people, is some of the best in Europe. But as a parent, you look at stories like that and you say, if that happened to my child, it would be absolutely devastating for our family. And that's why we have thought very hard. It's a big priority of Theresa May's. She talked about it on the steps of Downing Street. But what I've learnt in my time as Health Secretary is it's all very well having ambitions to treat more people, even putting more money in. But if you don't train up the professionals on the ground who can actually deliver that care, then you're not going to get anywhere. In the case of mental health nursing, we have 8,000 nurses in training at the moment. If we can get them all to work in mental health, that would be a 22% increase. So it's
But the pay cap is a terrible negative, isn't it?
Well, you know, I recognise that nurses in particular are working very hard. And I recognise the concerns that many people have expressed to me about the impact on recruitment and retention caused by the pay discipline that we've had. And that's now going to be looked at by an independent commission, and we'll listen to what they say very carefully before we make our decisions.
And that's before we mention the effects of Brexit. I mean, there will be people in the health service, in mental health and nursing, who will decide they're not going to live here anymore. They're going back to their countries.
Well, let me take this opportunity to say to the over 20,000 nurses from the EU who are working in the NHS today that they do a brilliant job, and the NHS would fall over without them.
But how easily will you be able to get any more from Europe? You're going to have some from Europe to fill these vacancies.
Yes, we are. And
how will you do that? Because today, Mrs May has made it absolutely clear that there will not be a 3-year period during which there'll be freedom of movement. No freedom of movement after 2019.
Well, freedom of movement will stop when we leave the EU because it is part of being in the EU. But we've made it clear that we won't have a cliff edge either for businesses or for NHS hospitals, so they will be able to continue to recruit from the EU after we leave the EU in March 2019 as we implement a new immigration policy. That will be a gradual process that will happen over a period of time.
I mean, you're in the Cabinet, you have the Chancellor saying one thing, saying possibly as long as 3 years. You have number 10 today stating out 2019 and no freedom of movement. I mean, where are you? Well, are you a Chancellor man or are you a Prime Minister man?
In the Cabinet, we are all Prime Minister men and women, as you well know, John. But let me say this. I've sat around the Cabinet table when we discussed those issues. And contrary to what you read in the media, there has been complete unity on, first of all, the fact that we are going to leave the EU in March 2019. Secondly, that the shape of that deal needs to respect the integrity of what people thought they were voting for, which is control of our borders.
But then did we make up the Chancellor's comments on staying possibly as long as 3 years with freedom of movement?
What the Chancellor said was that the implementation period following leaving the EU would take up to the next election, but could end before the next election, and that's what we're all agreed.
Secretary of State, thank you very much for talking with us.
Thank you.
Jeremy Hunt speaking to Jon Snow earlier.